Welcome to this week's live chat. Excuse me. Sorry. Okay, so this week, now for those students at CCTC this term, I know this can be a little confusing. This says week 12. However, we're actually in week 14. All right, but that doesn't really matter because what does matter is the topic at hand. The topic at hand is death and dying. However, we are going to discuss today the important documentation and things you need to know prior to the actual death. This is very important and relates to everyone, regardless of your health status and regardless of your age. So let's get to it. Advanced directives. Now, this is really very important. And again, regardless of your age, if you are an adult, categorically, by your age, not necessarily your behavior. Kidding. Okay. All right. But if you are an adult, you should have an advance directive. All right. You do not need an attorney. These do not go into effect unless you are unable to speak for yourself and let your wishes known to the healthcare professional. Okay, so there's no danger in it superseding what you want. And you may want something right now and change your mind in 10 years, piece of cake. Just write a new advance directive or update this one. The fact is that it doesn't matter how old you are. If you look into the case of Terry Schiavo in Florida, she was only like 27 when she fell into a persistent vegetative state. And her family, her husband and her parents, battled each other for 10 years at the cost of millions of dollars. And actually, the governor of the state of Florida got involved legally, which he had no business doing. But the point is Terry did not have an advance directive. An advance directive just says, if I cannot speak for myself, let this piece of paper speak for me. This is what I want to happen. This is what I do not want to happen. Okay, and then discuss it with your family. So what is considered an advance directive? A living will, healthcare surrogate designation, a DNR, a DNI, and organ donation. All right, so let's get into some specifics. Okay, well, let me go back for a second and do a little more detail. Okay, a living will is a document. It has nothing to do with your possessions other than the possessions of your body systems. There are pre-printed living wills that you can get. You can download it for free from the internet. What? Shock? Yes, but make sure you download it from excuse me, from the website for your state government, the state of Florida, the state of South Carolina, the state of Idaho, because there are slight differences between the states. You want to make sure that yours is legal in the state in which you live. Okay. It will itemize out things like, do you want resuscitation? Do you want blood transfusions? Do you want a feeding tube? Whatever. It lists out a whole bunch of things and of course lets you add to it. It lets you it provides you with specific, only if two doctors say there's no hope for me, I want you to pull the plug. Okay. So this speaks for you when you cannot speak for yourself. As long as you can speak or motion, do sign language, okay? This does not come into play. A healthcare surrogate is your designation of an individual who will make decisions for you should there come something that is not covered in the living will. And this can happen because you all know the innovation in healthcare is tremendous and moves very quickly. Okay. So this has got to be somebody you trust, somebody you knows maybe feels the same way you do about situations such as this. I recommend you do not name any of your children, even if they are adults. And the reason is, even if you and your children are very clear and all agree with, no, I don't want to live in a vegetative state, pull the plug, no machines, let me go naturally, that is fine. But you don't want to put your child in that situation. Okay. This does not have to be a relative. It can be your best friend. Okay. So, and yes, it can be your spouse, but there's a different with a child. Okay. So, it's recommended that you do not designate your child, even if your child is an adult. All right. Do not resuscitate means no CPR, no ventilator. Do not resuscitate is no CPR. Do not intubate is no ventilator. And organ donation is when you're done with all your pieces parts, if there's something left over that might help someone else, that's your choice. Again, you put it in writing. Yes, take anything that's usable. No, leave me intact. Or yes, you could take my heart, but not my liver. All right. Again, these are all your decisions. You have full control. But when you cannot speak for yourself because you're unconscious or you're in a coma or a vegetative state, this will make sure that what you want is not left to the opinions of others. Okay. All right. And again, no attorneys are necessary and you can change it at any time. All right. So advance directives are legal documents that, as I just said, allow you to spell out in writing, here's what I want. I want every member of the hospital staff jumping up and down on my chest trying to get my heartbeat going again. Or I do not want to be a vegetable and I know, all right, or anything in between. They must be in writing. They must be signed and have at least 2 non-relative witnesses also signing. Okay. As I said, each state has different forms and requirements. So you want to make sure to get the document from your state as opposed to anything generic. All right. And it will state on there if your state requires a witness or a notarization. You want at least one of those because, you know, you don't want somebody speaking for you. That's the whole point, right? You can ask a lawyer for help with the process if you feel that you want that additional protection, but it's generally not required. This does not require the skills of an attorney. And you have these choices to make all by yourself at every step. Okay. First thing to do would be to go onto your state's website and take a look at the documents. Okay. Now, the healthcare surrogate designation, basically, as I said, this is identifying another individual who you want to make decisions for you if you cannot speak or communicate. you're unconscious and something is available that's not covered in your living will, you want somebody there designated. Now, often married couples will have their spouses as designation, and that is automatic in the next of kin statute. However, you can change your, you can designate your sister, your brother, your uncle, your best friend. It's totally up to you. All right. These are alternate terms for essentially the same thing: a healthcare agent, a healthcare proxy, a healthcare surrogate, a healthcare representative, healthcare attorney in fact, or patient advocate. Different states call them different things, but essentially it's the same thing. You are saying, if I cannot make decisions for myself, I want Marcia to do it, or I want Harold to do it. Okay. And again, simple form. And I would ask the person if they agree before you assign that to them. All right. DNR is cardiopulmonary resuscitation. Did you know that that's what CPR stands for? Cardiopulmonary resuscitation. It restarts the heart when it stopped beating. All right. You've seen it on television 1,000 times. Maybe you've taken a course to learn how to do this. That's a good thing. Okay. You can say, you know what? If I'm gone, leave me. Now, generally, individuals with DNRs are very ill or very old, and sometimes both. Okay. You're just like, all right, if I'm going, let me go. Don't bring me back again. Or you can say, I want the whole security team jumping up and down on my chest, send lightning bolts through me, whatever it takes to bring me back. I don't want to go. Totally your decision. And that's the point. Okay. All right. A DNI, do not intubate. This is when they put that tube down your throat and a machine breathes for you because you are unable to breathe on your own. I'm sure you've seen pictures of this. I know there were a lot, because COVID was is a respiratory infection. You probably saw pictures of people in the hospital on a ventilator. In addition, you've probably seen it on television. Okay, so you want to consider, do you want a machine breathing for you? Sometimes it's very temporary, you know, for them to like let the medication take effect or something like that. And sometimes it's, we don't know if this patient is ever going to get off of this. But again, you've probably seen on television. Television brings us all kinds of experiences that we don't have to experience ourselves. But you've probably seen this on television where the patient is intubated, and then the family member needs to make a decision when to take the patient off intubation, off ventilation, to see if they can now breathe on their own or they expire. So sometimes it's better not to start that whole thing in the beginning. Okay. Again, your choice, you're the patient. All right. There are times when people get to a point, and again, this is not necessarily an issue of age. There are sadly young people who may have stage 4 cancer, who are at a point where science has nothing left to provide other than comfort care. It's also known as palliative care, which basically means healthcare services are being provided to reduce or take away pain, or to just make the patient more comfortable until nature takes its course. Okay. No medications, no treatments are being offered as a therapeutic or cure, repair, improvement. This is essentially for people in hospice, is a very good example of hospice provides palliative care, not therapeutic care. Okay. But it's an important option. You know, in some cases, some diseases, some conditions just wreak havoc on the body. And again, as guaranteed in the United States Constitution, a patient always has the right to refuse healthcare services. So all of these written directives that only take place, only kick in when you cannot speak for yourself. It's important for you to know what the options are. And again, I want you to remember Terry Schiavo, 27 years old. Okay. When my parents moved down near me, I not only have a living will and all of these documents, but I sat down with my parents. They were in their 80s and discussed this with them and had them complete these forms. And I told them that by talking about this now, I could make sure that their wishes were honored, that whatever they wanted. And I told them the exact same thing I told you, is if you want to go peacefully, gently into that good night, I respect that. And if you want, you know, the whole basketball team from the local college to come and jump up and down on your chest to get that heart started, I respect that too, and I will make it happen. Every person is allowed to make this decision for themselves. Okay, organ donation. We have come so far with being able to transplant organs and tissues, and it is so important for others. So before you go, this is a way for you to say, yes, you can take only my lungs. You can take my heart and my lungs. You can take my heart, my lungs, and my liver. You can take my heart, my lungs, my liver, and my uterus. Do you know that they now transplant uteruses? Or is that uteri? Okay. The point is it is a blessing to be able to give improved life. And sometimes life, like with a kidney donation, to someone who is suffering when you don't need it anymore because, you know. So think about it. But I respect there are some people who say no. And if that's your wish, we live in America, you get to have that wish, but I would put it in writing. Okay. All right. And again, you want to change your mind later on? Great. Just get a new form. All right. There's a thing called a POLST. This stands for Physician Orders for Life-Sustaining Treatment. This is intended for people who have already been diagnosed with a serious illness, like cancer, stage 4, or something else. And it does not replace your living will or your other directives. Instead, it's working with your physician. And it's kind of like a prescription, okay, to ensure that your doctor will order what you want or not order what you want, what you don't want, okay? This is another level of protection for you if you don't want it. Now, again, if you're 30 years old, you're young, there are going to be things that you're going to want that once you're 60 years old, it may be different, or once you're 80 years old, or now as we keep going, probably 100 years old. Okay. The bottom line is it's your decision. Every part is your decision. But if you don't put it in writing, it's not worth anything. Now, as you execute any of these documents, complete any of these documents, make sure that you make copies and give a copy to your primary care physician, so that your primary care physician knows about it. And then also make sure that your designated surrogate has a copy. And if you are admitted into the hospital, they will probably ask you for copies or provide you with new forms to fill out at the time. Okay. The point is that we have life-sustaining treatments. Sometimes the treatment is worse than the condition. Some people are not afraid of death at a certain point in their lives, and they're like, enough already. It's each individual's right to make this decision. If you don't put it in writing, it's like our coding motto, right? If it's not documented, it didn't happen. So this is your opportunity to save a lot of money and to save a lot of grief for your family and your friends by initiating this documentation. Talk to your parents. This is not wishing them dead. This is saying stuff happens, you know, buses and trains hit people. And I just today in the news, some people got shot in a subway station in New York. You know, stuff happens. It's not an intention, but you can make sure that what happens after stuff happens is the stuff you want to happen. Okay? All right. Chapter 12 homework is for your enjoyment. Read the chapter, enjoy the chapter, understand the chapter, and then do the chapter homework. And I put some extra stuff in the course for you, a little more about advanced directives and organ donation. It really is a blessing, and but still, yet again, it's your decision. Okay. You have any questions? Email me. Would you like to talk about it one-on-one? Email me. Would you like to make an appointment to talk on the phone? Email me. Would you like to have your own private Zoom with me? Email me. FaceTime. WhatsApp. I'm sorry, I can't help but say it that way. But whatever, however you say it, email me. Stay healthy and be prepared.